It's been the first thing that's really, really scared me in a long time.
Cancer patients and survivors are feeling the physical and emotional impacts of COVID-19. An American Cancer Society Cancer Action Network survey found half of cancer patients and survivors face changes, delays, or disruptions to their medical care.
Are scans necessary? They are, because that's what's going to show me if the cancer is shrinking, if it's spreading. But right now they just have to go by the blood work that I'm having.
It's been a month since the U.S. Department of Health and Human Services recommended hospitals cancel non-essential procedures. Dana Henry, a stage 3 breast cancer patient, has seen a few changes. She gave birth prematurely to her daughter Emery during her first cancer bout, and Emery's appointments are now held virtually. And Henry gets her chemotherapy via a pill. She says the drugs are still being delivered to her home, but other parts of her care have changed.
Have experienced some drug shortages in terms of other medications to help manage some of the side effects. All of my physical therapy appointments to kind of help control my lymphedema have all been canceled because they are considered non-urgent.
Would you agree that they're non-urgent, or is that something that for you is essential to your recovery and your treatment?
Yeah, that's kind of hard to answer. Obviously, it's impacting my care, but I would say that there's other people out there that are having their surgeries either moved up or changed around.
Then there's the mental and emotional toll for these patients. Getting in-person care alone, knowing they're more at risk of catching COVID-19, and being reminded of the hardest parts of past treatments can cause a lot of anxiety.
Just like that imagery that you start to see with the people in the mask and like the seriousness of it, it's really triggering for a lot of those emotions that you experience from, whatever health trauma.
Experts encourage doctors to try to see patients and continue care in person where they can. At hospitals like Mount Sinai, patients getting in-person treatment are screened for COVID-19 symptoms before coming in. But there are so many types of cancer, and while some patients' care can be paused, others can't.
It really is on a case-by-case basis for sure. And it does factor in the type of disease. Is the cancer slow growing or fast growing? What's the stage? Is it something that we caught early? What do we expect to change about the patient or the cancer in the next 2 or 3 weeks?
We still don't know what the end game will look like for COVID-19, but for cancer researchers and patients, there's no doubt when new coronavirus cases slow down, there will be an increase in cancer patients.
In the United States, more than 3,000 patients are diagnosed with cancer every day. And the sooner we diagnose cancer, the better it is in terms of the types of treatments required, as well as the potential for survival. So it is really going to be very important that as we move through this pandemic, that we find ways to not completely stop all screening for cancer.
Lindsay Thies, Newsy, Denver.